Hi everyone. We'll be getting started in just a couple of minutes.
Amanda, I just sent you a note in the chat.
Welcome everyone. We'll be getting started in just a minute or two. Thanks for your patience. All right, I think we'll go ahead and get started. I would like to welcome everyone to our webinar today on effective photo listing, best practices for developing strengths-based narratives. I am Mary Boo and I am part of the AdoptUSKids project. I work on the family support team. And we have been working as a collaboration over the last several months to think about how we do photo listing and public listing of children who are waiting to be adopted. And I'll be presenting some of what we've discussed today with, and I have two other people from our work group on that I want to mention. Tracy Sardinian, who's the Interim Project Director of the National Resource Center for Diligent Recruitment at AdoptUSKids is on, and she'll be organizing questions and breaking a few times to ask your questions. And then we also have Juana Dano, the AdoptUSKids website training and technical assistance manager on, who can answer technical questions related to the AdoptUSKids photo listing itself. I hope many of you know who AdoptUSKids is, but in case you don't, it's a federally funded project with funding from the Children's Bureau. And our mission is to raise awareness about the need for foster and adoptive families for children in the public child welfare system, and to help U.S. states, territories, and tribes to recruit, engage, develop, and support foster and adoptive families. And as I suspect many of you know, we operate a national photo listing with more than 5,000 profiles of children waiting to be adopted. Sorry, I'm having a little trouble moving the slides. So bear with me for a moment as the slides may take a minute to change. But I just want to talk, before we get started, talk a little bit about what our goals are here today. And excuse me. One of the things we want to talk about is what we hope will be a new paradigm of photo listing and public listing of children who are waiting to be adopted, with a really strong focus on protecting children and teens. As part of that paradigm, we want to have people thinking about both a public narrative and a private narrative, and I'll say a bit more about both of those. But a public narrative is one that is available to almost anyone, whether it's on a website, in an online photo listing, the newspaper, on a flyer handed out at a fair, a art gallery, or Wednesday's Child, or other television promotions. That's what we're talking about when we talk about a public narrative. It's something with no limits to the access. And then we also want to talk about a private narrative, and that would be one that is shared with families who have been through training and have an approved home study. And we think there are really different information that goes in both of those that, again, many jurisdictions are doing now, but we think we have more progress to make in that area, and we hope we'll all be in this together as we make these changes. And so we're going to talk a little bit about how systems can change to embrace the new paradigm. And then we'll give some specific examples of what caseworkers, recruiters, administrators, foster parents, and others can do to help accomplish these goals. Before we get started, I just want to get a sense of who is here today. And in a minute, you're going to have a poll, and I'd ask you just to take the poll and let us know who you are. I apologize, I'm having a little technical difficulty. Amanda, I don't know if you can launch the poll.
It was just showing
that it's going. Yep.
It was.
It's going.
Yeah.
Sorry. Let me quick look at. Again, I apologize. The slides are moving very slowly for me.
Mary, do you want me to move the slides?
If it will work better for you, sure.
Okay. So right now we have the poll results showing.
Okay. Yeah, not for me yet. All right, thank you very much. It's great to see who is here today. So I wanted to give you a little bit of background about why we think change is needed in this area. First and foremost, when photolisting started, it was most often a printed book, maybe at a library, or a pamphlet given to prospective adoptive parents. It wasn't quite as public as photolisting is today. And as we know, the world has changed. Information is on the internet. It's available to almost everybody. And we've seen in recent years significant cyberbullying. We've seen information go to birth parents. We've seen predators looking for information. It just is having very public information is a little bit different than it used to be. The other thing that's happened why change is needed is that we have new laws that may change the way we're thinking about children in foster care. And I'll talk specifically about the Health Insurance Portability and Privacy Act and the Families Educational Rights and Privacy Act. And we believe the spirit of those laws is that information is private and should only be shared when necessary and with the people who most need to know that information. And that sort of helps us think about our new guidance. And then finally, that we have seen people doing wonderful work with photolisting and with art galleries and with child narratives. And we want to encourage the entire field to catch up to what some people are taking the lead on already. So what is next is that I'll talk a little bit about how and why AdoptUSKids developed the guidance we're going to talk about today. We did a lot of work. We conducted focus groups of prospective adoptive parents, young people who had been in care, recruiters, caseworkers, staff at adoption exchanges. We had interviews with stakeholders. We reviewed what people are doing today. We considered the laws and data we just talked about. And we researched and spoke to many states about what they're doing today. And so this is how we really wanted to take this very seriously. As the national photo listing, we thought we could help gather information and share it that might help others come with us. And so again, in this new paradigm is really all about asking the adoption field to embrace the idea that the public profiles are about being strength-based, so that they are strength-based narratives with positive, descriptive information, up-to-date, and appealing photos. The paradigm puts a high priority on children's safety, dignity, and privacy. And it seeks to encourage parents to learn more about adoption before presenting those who are serious with additional information about challenges and disabilities the children may face. So as we see in this slide, we're really talking about a continuum of disclosure. And this is what it's about, that there's information that's available to the general public, and that, we think the goal of that information is to help families feel a connection, realize these are kids like other kids. The outcome is to have them feel more interested in adopting, and maybe adopting this child or a child like this one. Then there's another level of disclosure for families who've been licensed or certified, been through the home study. And for these families, there's a different goal, which is begin to consider what issues or challenges they may be able to address. What child was going to fit well with their family configuration and their life, and have them get to know a bit more about the child so that they know what questions to ask. And then finally, there's a third level of information we want to talk about, which is information for families who are moving closer to an adoptive placement. And this is beyond the photo listing or beyond any public sharing of information. This is the goal, to let the family know everything they need to know to decide if this is the right, if they can be the right family for a child, and if they can meet that child's needs and what supports they might need. And again, I want to just say, I'll say it a couple of times in this presentation, the goal here is never to hide information. We firmly believe in full disclosure for parents, but we just believe in sharing it at the right time in the process. And one of the things that was very powerful for us when we were doing this work was learning to think about this from the young person's perspective. And so we ask people, as we begin to think about how we do public narratives, is to walk in the youth's shoes and just think about the fact that the information is available to their classmates, their peers, possibly people who are bullying them. It may be accessible to birth family members, as I mentioned earlier, to predators. It really is open to the world. And thinking about what that means to a young person, the risks it can pose, and risks of as serious as something happening to them, but also risks of embarrassment, shame, things that can be very real to a young person. And so when we were talking about this guidance, we really put ourselves in that place and think about what do we do in our own lives when we share information. And for most of us, there's a continuum of information sharing that we go through. And I think I'd ask you to think about examples of that in your own life, but I'll throw a couple of them out there. First is if you're seeking a job. You're going to do your resume, and it's your best foot forward. It's all of the things you really think make you the right person for the job, and you say the good stuff. And then at the next stage, if you're called in for an interview, you might have a conversation. Somebody's going to ask you about your weaknesses or areas you need to grow. You'll say a little bit more about some of the challenges you might be facing, things that have been a little bit difficult for you. You're still being as strengths-based as you can and as positive as you can, but you're sharing a bit more information. And then finally, once you're on the job, you may say to your supervisor, I really struggle with time management and deadlines. Can I get your help with this? And so it's that continuum of information sharing that we do in our own lives that we want to do for children and youth who are waiting for a family as well. And another quick example that people often use, but I think is a pretty good one, is online dating profiles. If you do such a profile, you're really putting out there what your best self. And then when you're starting to date, you might have more conversations about, well, here I'm kind of quirky in this area. And then as you move farther along, you're like, okay, I really need to disclose that I need 3 hours at home after work every evening without talking to anybody. Is that a deal breaker? So again, it's this continuum of information sharing that we want in our own lives, we want to offer to young people as well. So first I'm going to talk about the public profile. And as we went through this, we found there were 3 different areas that we highlighted, and we called that what to include, what to consider carefully, and what not to include. And when our work group was doing this, we called these the green light, yellow light, and red light items. And they really helped us decide what was, is this something that should be in a public profile or not? And so I'll go through a bunch of those and excuse me. And so what to include in a public profile? The first is, and this sounds simple, but the preferred first name, but it isn't always. We often see young people, where it'll say Robert and Bob and Bobby, and the names may switch back and forth. So we would recommend just picking whatever name the child goes by and use that throughout a narrative. It helps prevent confusion, especially if the nickname isn't much like their name. And again, that's what the child wants because that's what they're called. And again, we're really thinking strengths here, so positive personality traits, cheerful, helpful, sunny disposition, chatty, talking about the things that they do that bring value to their family and to the people around them. We want to talk about strengths. What are they good at? Maybe they're good at helping younger kids in the family get dressed for school. Maybe they are a good student. They love to help around the house. Things that make them proud. One of the another thing to include, obviously, hobbies, interests, and pastimes. Again, most narratives have that. But again, the things that they like to do in their free time, and whether it's playing inside or outside. But more than that, do they like to go camping? If so, do they like to camp by the river? One of the things we talk a lot about is to make narratives particularly engaging, you really need those details. Those details are how people are going to make a connection. If your narrative says he likes to read, that's great. But if it says he loves to read the Harry Potter books and once he started he couldn't put the 700-page book down, someone may say, I remember going to the store and getting that book at midnight and I couldn't put it down either. It's in those details that you're going to pique people's interest and help them maybe make a connection with a young person. We'd say to conclude what they like about school. What are their favorite classes? If they don't have a favorite class, do they like helping out? Do they like passing out papers? Do they like getting dressed up for school? What are the things that make school a good experience for them? There are really good questions to ask, like what makes them laugh? Again, that gives you a sense of who they are, and maybe a question that doesn't show up as often in narratives. And then things that are important to them, and I should say things and people. So it might be a pet, it might be a favorite stuffed animal, it might be their grandparent or their sibling. And again, I don't want to put those all on the same level, but just again, knowing what's important to somebody really tells you a lot about who they are. And so the key, I talked about details. And the way to do that is to ask questions and to observe depending on what the child is like. And so we'll talk, the most important thing to getting a compelling strengths-based narrative is to have information gathered by somebody who either knows the child or someone who can take the time to get to know them. And so maybe that's a foster parent, maybe it's their worker, maybe it's recruiter, maybe if it's a teen and they're in a mentoring program, it's their mentor. And we have on the AdoptUSKids website a sample of questions. I have many of them here, but there are, so what are your favorite things to do outdoors? So it's not just he loves to be outside, but what's the best thing about being outside? Does he like to ride his bike? Does he like to play basketball? Does she like rugby? What are the things that, those details that can give color to a narrative? Again, asking about favorite author or book, types of movies. So rather than just he likes movies, what was his favorite? What's the one he's watched 10 times? Because putting that in a narrative can make it really interesting. She'll watch Lady and Tramp over and over again until you're completely sick of it. Or just that's things that can give life to a narrative. There are a few more questions here. I won't get into all of them, but there's some that I really like. What if you had 3 wishes, what would they be? Again, I talked about earlier, what makes you laugh? And this is a good example where if you are with a young person who maybe isn't as talkative, if you sit back and observe, you may find out what makes them laugh. If you're watching TV, you're going to see the things that triggers. Is it a pratfall? Is it a clown? Is it, a dog? Is it, what are their favorite shows by what they turn on TV? Look around their room. What are the books that are close to their bed? Is there a stuffed animal on the bed? So even if they don't feel particularly chatty when you're talking, if you sit back and observe, you may get some of these answers as well. And then these are some of the questions on this last slide that I really like, because they're, again, about what they're doing well. What are they really good at? And so it's, even if they're not, on a championship team, if they say they're really good at ice skating, that's great. Put that in there. It's what makes them proud. What makes them excited about their day. At school, what do they like learning about? In school or out? Who do you like to learn from? We often get, I think some of the questions that get at relationships they have in their life are really make people realize this is a child who fits in a family and can be in a family. So what do they like to do with their foster parent? What do they do with a mentor? What would you like to do with a family? Those are things that help people see the future of this child in a family and know that this child, like all children, deserves to have a family of their own. So next I'll move on to things that we want to consider carefully. And these are what we call the yellow light items. And these are things that we think should be considered on a case-by-case basis and used with caution, and still always from a positive and strengths-based perspective. One of the things is a general statement about long-term needs. You'll see when I get there that we're going to say not to include any medical information. So we would never say long-term health needs or medical needs, but that it's okay to say that this child will have, a family needs to be available to meet this child's long-term needs now and into the future, or this child will need support into the future. So it's sort of general statements without getting into the specifics. And I'll say about this that we know that all children who are in foster care and who are looking for family need support. They need guidance, like all children, but even more so because of the trauma and loss that they've experienced. And so, keeping those statements general and keeping those statements in information you share generally about adoption from foster care can be a great way to do this as well. I'm going to mention a couple of the other things on this slide. Discussion of appearance is a really interesting one to me. And I'll just say that a lot of what we came up with as guidance was from reading hundreds, if not thousands, of narratives and looking at them in with the eye of what is really going to help a child get adopted and what makes what feels right for a child's dignity and privacy. And we would say never, and we'll get to this, never include any negative descriptions of appearance, but even general or generic or positive descriptions of appearance should be taken with caution. And I'll start with the generic can actually, if you read a number of narratives in a row, can almost, I hate to say this, but I'm going to, that it can almost feel like a catalog. This brown-eyed, brown-haired girl, this blonde, blue-eyed boy, just feels like it's about their appearance, and it just feels like you're categorizing them in some way. And again, we know with virtually all of these narratives you have a photo, and we think it's better to let the photo do the talking. But I'll say also people sometimes are writing very positive things about children's appearance, but we have seen that where it actually begins to feel a little bit on the other side, where it either feels like it's marketing a child, or it can sometimes even feel like that the value is in the appearance. And so we just say take appearance carefully and think about it. I'll say that sometimes, and I'll say a little bit more about children who are nonverbal or who have very significant needs, that there are cases where you might talk about a cool haircut or their favorite outfit. So it's not never with appearance, but to use it cautiously is what our experience has been with this. Another thing to consider carefully is the youth expressed preferences on type of families. And I'll say, we're going to get into that we don't think the public narrative is the place to limit families, that you really want families to feel welcomed into the adoption world and that there's a chance for them to be a family. And if the child's preferences are so strong and they really want it in there and you've engaged them in the process, that it's okay to consider that. But just if a child says, oh, I want a mommy and a daddy, without a lot of thought and preparation, what that may do is make it more difficult for people to envision themselves as this child's parent. I'll talk just briefly about sexual orientation. This is one that we have both in the don't include and in the think carefully about, because in general we think given the risks to children still today with sexual orientation, that it is a risky thing to put in a child's narrative. They could be teased, they could be at school they could have issues there, or with parents or caregivers. But we also don't want children back in the closet. So if a young person is developmentally able, wants the information in the narrative, they've been informed about the risks, and they've been part of the process, we also believe they should have that choice to do that. And I'll say just quickly about if the fact that the youth is a parent, we say to consider carefully so that you keep the narrative about the young person. We'd say the same caveats above, that if the young person wants it in there and they've been part of the process, that mentioning they're a parent is okay if they want it, and if the focus remains on them and not on the baby or the toddler. Because what we've heard about is places where people will come forward wanting to adopt a teen who has a baby because maybe they want the baby, and we believe that's a process that social workers will be thinking about and caring about. But so cautious about putting it in the profile. But again, we don't want young people to feel ashamed of being a parent if it's something they're proud of and they really like about their life. And then I've alluded a little bit already to some of the things we say not to include. And I think some of these are, for some people, are going to be quite different than what the field has been doing, and some people have been doing this all along. And some of it is fairly obvious. Identifying information is certainly something to be incredibly cautious about. We've seen narratives where clearly it was an accident, but there have been last names or dates of birth, even I think Social Security numbers. Other things that are close to identifying depending on the child's name, like a school name. And again, something to think about here is, I didn't say it probably enough earlier, that it's really good to talk about what a child is engaged in the community, like if they're with the Boys and Girls Club or they're in the Girl Scouts. But if it's a small town and there may be only one Boys and Girls Club, be careful about things like that, where it can give geographic information about where a child would be and when they might be there. So another thing is, we don't think the narratives should have any information about abuse, neglect, and maltreatment. That is extraordinarily personal information that we absolutely believe needs to be shared with prospective parents, but again, farther down the road when they're really considering a particular placement. We also don't think placement information, such as their length of time in care, if they're in group care right now, or if they have had multiple placements or moves, if they've had adoption disruptions or disillusions. Again, that's very private information and often doesn't say so much about the child. We know that in this country, in many places, children end up moving through no fault of their own. We know that children are in group care who don't need to be in group care because we have a shortage of families. So we think it both can hinder their chances of being adopted and can share very private information if it's a group home or a hospital type placement. And one of the things I'll say is that this is where watching language in the narratives can be really important, because you could say, the staff say she's really great. Well, that is a wonderful statement, but it also suggests she's in a group home or institution. And so kind of watching your language to see what it might be alluding to, as well as what you say directly. We don't think any medical information should be in the public narrative. No behavioral challenges. Again, the public narrative really is the best foot forward. It's the strengths-based. And no potentially painful or embarrassing information. Again, we've seen things here about hygiene problems, about being overweight, having skin problems, being particularly small, shy, won't talk to anyone, things like that that could be something that a child could be teased about, or that could be negative information in their life. As I mentioned earlier, we think things that limit families, so saying we're only considering single parent or we're only considering female parents, that's not the public profile is not the place for that. Because again, we know first of all that all sorts of children do really well in families that weren't necessarily what people were considering right up front. And we also again want people to feel like, oh, all kinds of families can be a resource for this child, for children who need families. We also don't think educational challenges or intellectual ability should be in profiles, and that could include whether they are developmentally delayed, if they have an intellectual disability, if they have an IEP, if they're struggling in class. We do think it's okay to say, you know, she gets extra support in school or has a smaller classroom. So sort of general statements that about a child, he's thriving in his small classroom. But again, presenting all of those with the positive, she's doing really well in her small school, are ways to present information in a positive way. And I already mentioned the sexual orientation or gender identity is basically not to be included with the exception, again, of for sexual orientation if the youth is out and has been well prepared. And I want to say that one of the things that I said this earlier, there are some other things in our guidance about not to include things like legally free. We think a couple of things about that. One is it's a term that doesn't mean very much to people who are just engaging in the process. It also, if you have 5 children listed and 3 are legally free and 1 isn't, does that disadvantage the one who isn't legally free? Again, information that absolutely positively must be shared, but a little bit later in the process. And again, I'll probably say it a couple more times, that none of this is about keeping information from people who are moving forward with the process, who have a home study. This information must be shared with them, but just at a specific time in the process. And I'll just say a tiny bit about photos, and there's much more that could be said about photos, but what we know is from the people that we've talked to, and I suspect most of you have had this experience, that the most effective way to get more inquiries and to increase interest in the children you've listed is to have an updated and improved photo. The photos should be positive and of good quality. They should be updated regularly. Another thing that's a real disconnect, if you have a picture of a 6-year-old and the description is talking about someone who's a teenager, just fairly confusing for families. And then one of the things is that photos should not reveal information. And I'll say a couple things. There's both photos of a child, for example, in a school jersey or T-shirt. We've seen pictures of kids in front of street signs or in front of, like, again, I said Boys and Girls Club or a group home with a sign visible. But it's also depending on if you're using an online photo listing, you want to really watch out for geotagging as well. That most smartphones are now geotagging, and you got to make sure those are removed, because if somebody could take that, they could know exactly where that child either lives or goes to school. The other thing to think about for photos is just the content of the photo. Is the photo are they wearing a T-shirt that has a weapon or a threat on it, or is the clothing too revealing? And we have heard stories of photos being taken and used on nefarious websites, even though it's an innocent photo. They can be shared and different captioning put on it in order to interest people who do not have the best interests of children at heart. So I will pause now.
About
we're ready for questions. So yeah.
Perfect. One person asked how often you recommend updating the photos.
I think the places that we've talked to that have it say either 6 months or a year. I mean, sort of year at the outside, but every 6 months as things are changing, if you have the opportunity. And one other thing I'll say about updating photos is that we say, photos should be of good quality. If you have an average photo, that's okay. It's to use and then just update it as soon as you can, because having an average photo is better than no photo in terms of we just know that photos are what get people to stop and pay attention. But so this is my my stopping place for other questions. Tracy, do we have any others about, again, particularly if people have thoughts about what we've said should be included and shouldn't be included in each of the different categories. Questions or concerns about that?
Another question we received was, is it appropriate to share information about a child's religious affiliation?
Yes. I mean, if it's important to them, absolutely. I think, again, if that's something they're proud of, something they're engaged in, absolutely. What I would say, we would say is don't say he must have, if he loves going to temple, you don't have to say he must have a Jewish family. You may want to say he has a family who must support his faith. You want I'll say the same thing about other answers like that. If we see proposals that they must live on a farm because he likes horses. Well, how about somebody who will make sure he gets riding a couple of times a year? Thinking, casting the net wide and then finding the right person as we have other opportunities down the road. Do you have other questions? Do you have other questions?
How do you recommend letting prospective families know about challenges kids may have experienced or issues that they may have faced if you don't suggest including that in the public narrative?
That's the next section is we'll get to private narratives in a minute. So if we can hold on for that one, that would be good. Or we could take that as a segue, but do you have other questions? And again, folks, please type in questions, concerns. I'd love to get feedback and interaction as we move forward. It's great to hear from you all.
We don't have others now. Oh, well, we do have one, I guess, as we're in the photo section. Will we be addressing video profiles at all?
We don't have anything written yet about videos. I can say a couple things about videos. One is, again, be really careful about location, that it's not taken somewhere that's too obvious, where the child might be. And again, we don't want to be too paranoid, but we just know that all of us are in this for the best interest of children and need to protect them. The other thing and again, Tracy could speak to this as well as I could, was just on a presentation about someone about photos and photo concerns and just how videos can be used for ill. Talking about if you have children using on a bouncy horse, a teenage girl bouncing up on a bouncy horse can be taken from the website and used somewhere else as something that would be titillating to someone who is a predator. And it really opened that, just hearing that presentation again very recently, it opened my eyes to the things that and I'll say this about the photos too, that thinking about things that can be used for ill, that you just want to keep it general. You want to make sure, again, location is not shared, and that again, when we've talked to people about doing videos, they've said having the kids do something they like is really important. That if they like to play basketball, you do that. You get them comfortable first, and then if you're doing an interview, that needs to be somebody who they are familiar with. When possible, sharing all the questions in advance so there are no surprises. Make sure you've gone over it. I should have said this about the interviews earlier, that before you're asking questions, for example, about sibling connections, make sure you know the case well enough to know that this is not a trigger point for the child. That again, the first instinct, the first effort has to be to not trigger the child or make things worse. And I'd say the same thing with the videos, that making sure that if you're doing any interviewing, it's not about their case, it's not about the losses they've had, that it's about things that they like doing and want to do. And Tracy, are there any more? Because I wanted to add one thing that I didn't cover as well as I
do have a few more. Do you want me to ask them now, or after?
Sure, you go ahead.
Okay. We had a question about what is geotagging.
Sure. Oh, I'm sorry about that. So most smartphones and I think some other digital cameras can now, they put the location. So they have a tag embedded in the file, the image file, is where the location was, and those can be translated into addresses. So I don't know for all of you, I have an iPhone. For those of you who have an iPhone, if you sort your photos, it'll say, oh, you were in Alexandria, Virginia. These are the 42 pictures you took in Alexandria, Virginia. Here are 3 in Door County, Wisconsin. And so if you're posting pictures on a website without stripping off those geotags, you could be giving a child's location.
We have a few more.
I'm sorry, Tracy.
Go ahead, Juana.
Can I just add something to the geotagging?
Please
I'm on the digital media team here at AdoptUSKids, and I just want folks to know that for AdoptUSKids, the process that we use when we upload the photos and process them, it strips any geotagging that may come with the photo that gets emailed to us. So for AdoptUSKids, there won't be any geotagging on the photos.
Thank you for clarifying that.
And actually, there's a couple questions that might be for both of you, Mary and Juana. Is there an option to only have a private narrative for a child?
Unfortunately, no. The public narrative is required.
Okay. And Mary, do you want to add any sort of workaround for that?
No, I can't come up with one. I mean, not for AdoptUSKids purposes, so no. I guess I would say you could certainly, the question is, I'd be curious to know why someone didn't want a public narrative. You could certainly have a listing without a photo. And then, I think, Juana, correct me if I'm wrong, but we've talked about there are some kids who maybe were in cases where there was press where you might not want to include a photo at all. You might use a child's drawing, one of their drawings instead. So you might do something like that if it's an issue of not wanting a public photo, and then you could have the details in the private narrative where you're driving your home-studied families to be able to get more information. But again,
yeah, if you have a child that there are concerns with, we can put a silhouette on the profile. So you would just, we would need to know though, so that we can put the silhouette on the profile. Another option is there is the ability to make the child's profile available to only registered workers, but not a way to, at this time, to just share it with registered families and workers.
Great, thank you.
And I think that answers this question of how do you list a child who's legally free but whose name and picture cannot be displayed due to threats by the bio family. I think, does that feel covered?
I think, again, we've said, and I'm not talking specifically about the AdoptUSKids photo listing, and people would have to do it for their own. But we did talk about that in guidance, that there might be times where you would use a pseudonym, and maybe artwork the child had done, and that it's still their personality, their strengths, their hobbies, but that you use a pseudonym that that you can translate internally. So that we definitely again want to protect the children first.
And will there come a time when we can upload more than one photo? I would love to show another side of my child, even some of their art.
We do have that on our list of features we would like to develop.
We show a child's year and month of birth, not day. Is that okay?
We were recommending year only, but I think there's not I don't think there's a huge difference. It's not. You can't find someone's birthday just from that. But I would say year is, again, to be extra cautious, I would go with year. And just that's a good point that we talked about not putting a child's age in a narrative, not because, again, on the AdoptUSKids photo listing, it translates and will give you the age, but many photo listings don't do that, or in profiles in other places, and that if you're not updating regularly, the age can get out of whack. And if you have an updated photo at a young age, it's just one of those things that we've seen a number of times where the age doesn't look right for what you're describing. So we do recommend birth year.
Can we get feedback from you on a difficult to write narrative later?
Sure. I think, again, we depend on, if all 5,000 people say yes, it would take us a while. But I think yes, and we would love to do that. And one of the things, one of the things I was going to say earlier is that I know people struggle a lot with children who are nonverbal or with those high medical needs. And we have, in the guidance, we have a couple of examples of that, and we can certainly find you others. And I would just say this is, again, I don't know if this is one that someone is struggling with, but it's the thing I was going to talk about earlier and forgot, which is just that you can still talk about what a child is and does without naming their disability. So if you have a young person who is nonverbal, you can say, oh, she points at the things she most likes. She smiles when her foster parent enters the room. Her favorite outfit, is a snuggly purple tracksuit. There are, these are the things, there's still things that are important. Loves to go outside and go for car rides. And so again, those I think are some of the ones that people really struggle with. And this is where you really need a partnership with the caregiver so that they can tell you, if you're not the person seeing the child regularly, what are the things what makes them smile, what makes them light up, what are the things that they like to have with them. So I think those are some of the harder ones, and we can definitely provide some feedback.
Mary, we have more questions and comments coming in, but would you want to continue on and then get to some of them later on?
Yeah, why don't we do that? And then, and again, we will. I'm guessing we won't have time for all of the questions, but we will do our best to follow up with everybody. And I know that correct me if I'm wrong, Tracy and Amanda, but I believe we get the questions and who asked them, so we can follow up afterwards if we don't have time.
Yeah, and could I, before we move on, just make a couple quick comments of things that have come in? So one of the things was that some people were having difficulty getting on the phone line because it had reached capacity, and we fixed that. So if people were having trouble calling in, go ahead and call back in, and or if your colleagues were, and you should be able to join now. And the other thing is we've had a lot of questions about, will you get the PowerPoint afterward, and we will send the PowerPoint to everybody who registered, and also a link to the guidance.
Thank you, Tracy.
Sure, thanks.
All right, let me move on to private profiles. And this is, and one of the things I want to say again is that we're talking about all sort of public listing, not just the AdoptUSKids photo listing. So some of this stuff is fairly easy if we're talking about AdoptUSKids. But as I said earlier, a private profile allows you to share more detailed information with those families who have a home study. And it really helps prospective families decide if they want to learn more, if this might be the right fit for them. And for AdoptUSKids, it's another part of the narrative that's part of the photo listing, and we have verified that those people have home studies. But you can do this even without having that technology. A private profile could be something that you share by mail, or you could share even in email. It doesn't have to be through a photo listing service. So I think a lot of people worry that if I don't have a technology solution to have a private narrative, I can't do this. But there are other ways to share this information. And I'll get into sort of what to consider putting in the private profile. And again, we want to say this is the place to begin to talk about some of that private information, because it is a protected space, or it's shared with just a very limited number of people. But it still isn't the case file. It still isn't the be-all and end-all. It's still a place to be strengths-based, and it's still a place to talk about progress and things the child is doing well. So, but in the private narrative, we say before you put something in the private narrative, does it help the parents better understand the child's needs and decide if they might be able to meet them? And Tracy, can you move to the next slide, or am I just showing the previous slide? Oops, not that one. Okay, we'll just hang on a second. That's where we want. Yep, sorry.
Okay.
Yep, that's where you are. Sorry. Is the information still respectful? Does it still protect the child's dignity and privacy? And is this the right time and place? There's some information that really requires a conversation. Some information that we consider either stigmatizing or concerning that you still wouldn't share in a private narrative just because it could be screenshotted or could be shared in a different way. And then you want to make sure the information is really easy to understand. You don't want to put a ton of medical information that may or may not be meaningful to parents. You want to make it clear enough that they understand some of the issues, but know that there's more to be learned in those next conversations. And then we'd also say try not to use acronyms or jargon that may not be meaningful to prospective parents, even if they've been through the home studied process. So then we'll say, so one of the questions is, we'll do a quick poll. I think we're on that slide, Tracy. If want to know if your photo listing, if your state has a private narrative for registered home studied families.
There are a lot of responses coming in, so I'll just give another moment.
Thank you.
Now showing the results.
Okay, well that's more maybe than we thought. So that's good. So some of you already have an avenue in place, but as I said, you don't need to have the technological solution in order to share information. Additional information can be as easy as a flyer or just additional information that you share. We know some states who do it all by conversation, so they don't share it in print. So let me go to the next slide and we'll talk about what we think goes in the private profile. I think it's the one after that, Tracy. And so first is functioning or disability level, and I'm sure people are familiar with this. Many of the photo listings have it, including the AdoptUSKids one, where you have different domains, so cognitive, behavioral, physical health, and having different, mild, moderate, none, severe. And we'd say that this is the place where you do that level of information for families. So you might say, and you also of course have to have a place where you define these, because again it's helpful for people to know what it means if you say mild. What are the types of things might be included if someone has a mild cognitive delay, that they're still functioning well at school but may need a tutor, things like that. So again, so that big picture sort of overview of their functioning level and the different domains we think is a great thing to include in the private profile. Here's where we definitely believe in talking about their ongoing or long-term medical needs. This is where you might talk about a child being medically fragile or nonverbal, specific diagnoses they've had. Again, definitely want it to be a diagnosis by a qualified medical professional, and factual statements about it. And especially if they're, again, in a way, keeping it strengths-based and positive if they're making progress. We've seen wonderful ones where people are talking about, she was diagnosed with cerebral palsy when she was very young, and although they thought she wouldn't walk, she can now run and play with the other kids in her home. So still keeping it as positive and as interesting and engaging as possible, and noting progress wherever it's made. Here where we believe we have information about their disabilities or challenges with school and education, the specific supports they may need or may be getting, how they're doing in school. And I'll say this, even in the what to include, if they're doing really well in school, we still don't believe that it's right to put their grades or IQ scores or assessment tests in the public profile. Here you could have that type of information if it's really relevant to the child's performance. But in the public profile, even if it's positive, don't think their test scores or their grades are really open for the public to look at. And again, here definitely would want to put in their support needs, if they need ongoing counseling or therapy, if they are needing to be, again, we've seen with many who are medically fragile that they need to have access to a significant medical facility that can meet their needs. So this is the place to put some of that information. And then what else to include here is next about the type of family being sought. So here, and again, we say, this is where you can include if the child has specific preferences or if you think there are, needs that need to be met, but also the skills they bring. Is this you do want a parent who has educational experience? Do you want a parent who is a strong advocate? Those are the types of things that can go in this private narrative, because this is where it's being seen by home studied families, where families are really thinking, oh, am I that? Can I meet that need? So this is the right place to be putting that information. Again, this is where we'd say if a child is LGBT or Q, if they want it in the private narrative, we still believe that should be the child's choice at this level of disclosure. And again, this is where the key is the social work. That if a child is LGBTQ, the key is making sure that the families being considered are open and accepting and supportive. And as I noted earlier, so this is where we would definitely talk about adoption assistance eligibility and whether they're legally free or not. I'll say I don't have a slide on it, but there are a couple of things that we still don't think should be included in the private narrative. One is some of the more stigmatizing behaviors. We do think behavioral challenges are okay in the private narrative, but some of them, such as sexual acting out, cutting, some of those with that, again, could be very stigmatizing. We think it's better left for discussion, and that you could have a statement that the child has some serious behavioral issues to be discussed with prospective families, or has behavioral issues to be discussed. Again, in your functioning level, you will have given them a level there for that there are behavioral challenges to be addressed. We also, sort of for the same reason I talked about it earlier, don't think this is the place for placement information. That's a next step as part of the conversation down the road. That again, number of placements disrupted adoptions. We just think that again says as much about the system sometimes as it does about the child, and is definitely to be disclosed and discussed, but at the next stage in the process. And that next stage is really where you're in the conversation, worker to worker, and that's the place for that. So that's what we have to say about private profiles. And I have, so now it's Tracy, do you have any questions about private profiles?
We do.
Good.
I'll start with it. I'm concerned on what should be shared on private or confidential narrative for children who have sexually molested a younger child. How should this issue be approached when trying to recruit for a child?
Again, I'll speak to it in terms of the different, I'll speak to it from the, as I just said, we think the private narrative is still not the place for talking about molestation, but absolutely, positively, that needs to be disclosed to the family if they move any further on. We would definitely say that this might be a place, so we talk about the types of families being sought. The private narrative might be the place to say seeking, parents without other children or older children. Again, we don't believe in that, particularly things like that, which are really code word that many of us understand for someone who has sexual acting out or a sexual reactivity. That's not public profile, but the private narrative talking about the type of family you're seeking and not having younger children would be the right place in the private narrative. And then again, in the discussion, in the AdoptUSKids, there's a confidential narrative, and that is available only to workers who have registered, and want to correct me if I didn't get that right. And so that is a place where you could put that information in the worker to worker in the confidential narrative. And it's definitely a place to, it's something that has to be discussed with parents once they're interested.
Another question that we received, Anna Marshall, who leads our digital media team, actually answered in the chat. So we received a question: if the private profiles are online, should people be concerned about hacking and that information being made public? And Anna wrote, regarding concerns about hacking, we are confident that our system is secure. So I wanted to share that.
Thank you.
Another question. We are a matchmaking organization. Prospective parents contact us about kids we list from various states, and we help them connect with the responsible caseworkers and follow through. May we verbally share the private profile?
Absolutely. Again, so I think it depends on it. We would still say it's not. If it depends what you mean by prospective parent, and I think if we're talking about a parent who is, who's somebody who's been through the home study, absolutely. We know of places where that is the sort of verbal conversation. If you're talking about somebody who's just starting out in the process, we'd recommend, and I'll talk about this a little bit in the next little phase of this, is we'd really recommend that for those families you want to talk about the general needs of children and youth who are in foster care, and that they've all experienced trauma and loss. They will all need special support and care, and that that we want them to start moving through the process and learn more, and then they can learn more about specific children. And that we think one of the ways to do this, both with home studied and non-home studied families, there's a change that they're going to have to go through too if there's less information available publicly. And we want to just make sure people are on board that we are all in this together to protect the kids. And the reason we're making you take this extra step is because it's the right thing for kids. And we know because you're interested in foster care and adoption that you want what's best for kids as well. So I hope that answered your question.
Great. And do you want me to continue with questions, or?
Sure. If you have we're good. If you have a couple more.
Okay. Are children ever removed from AdoptUSKids? For example, if they reach the age of majority, are adopted, withdrawn, etc.
Juana? Yes, I think is the short answer. But Juana, will you answer that one?
Well, they're removed from view from the public, and so the only ones who have access to that are the workers that registered the child or anyone in that agency. It's now been enough time that AdoptUSKids has been up and running that we know that we have to start archiving kids, and so we're working out that process right now. So we don't have anything in place, but we are working on it.
Thank you. Any other questions, Tracy? We still have some time at the end. I was just going to talk a little bit more about what else people can do, but you tell me.
Let's go on, and I'll continue to sort through them.
Okay. So next we're going to talk about sort of what different people can do if you like what you heard and want to make some changes, what people at different levels might be able to do. And the first one is sort of what administrators can do to support strengths-based photo listing. And the first one is, adopt guidance like we're promoting here at AdoptUSKids, and embrace the philosophy that we want to protect this private information and share it in stages. And I'd say if you're not sure if you're an administrator, or supervisor, or manager, and you're not sure what your state is doing, take a look at the kids photo listed on your website, your Heart Gallery on AdoptUSKids from your state, and see what's happening in your state right now. So that's the first thing, is to figure out where you're at. And again, to bring the lens to it of, as you read these narratives, does this make me want to learn more about a child? Does it really present them with their best foot forward? Because I think there's two levels of review here, and I'll say this both for people writing the narratives and for administrators, is are we following guidelines, whether these are your own, but there's also, am I interested? Do I find it compelling? And I have to say, after reading hundreds, if not thousands, of narratives, when you get to a state or a jurisdiction where they have the details and they have good writing, they bring tears to my eyes. I want to know more. I want to learn more, even after reading thousands of these. You can just feel the difference. So I'd say the first thing administrators can do is check out where their state is at, and then think, we hope we'll adopt guidance like this, and set policies for how their state will go forward, and what they'll include and what they won't. But you also have to look at the system and what, if you don't have a private narrative process now, how might you do that? How might you might make a specific inquiry email. This is what we're going to send to non-home studied families saying, thank you so much. We really want to engage you in this process. Before we share more information about specific children, here's an orientation. Again, you want to screen in absolutely and be strengths-based and positive to them as well. So you really want to engage those prospective families while also saying you'll get more information when you're farther along in the process. So you have to look at your systems and do you have that in place. Then you have to think about how you're going to share the philosophy with others. If this is, again, for those of us who've been on this work group, we've pretty bought in that this is the right thing to do. But for some places it's really a change. And so you might have to do training for staff. You might have to consider how you do staffing differently. Do you have somebody who's specifically writing narratives? Do you say, hey, here's information, here's a form you can fill out to get the details we need to make these really good narratives? Do you need to look at how inquiries might be handled? Because we don't want to, you could have more inquiries from non-home studied families, and so you need to have a way to respond to them. Again, that's why I'm saying you have the set email or phone call. We really want you engaged in this process. We want to move you forward, but you might have to think about how you do that with your existing staff. You might want to think about whether you have a dedicated writer who gets information from workers, foster parents, and others, and can write something really compelling. We know a couple of jurisdictions that do that where they have people just dedicated to writing really good narratives. You might want to look at what's your process. If you look at the narratives that are out there and you're like, oh, some of these aren't that good, you're going to have to come up with a process. Okay, how do we make these better? And that's really a two-stage process because you could look at the narratives and say, we want to comply with these rules, this guidance, but then you're editing something that may never have been written from a strengths-based perspective, and that's actually harder in some cases. And you have to look carefully. So you might want to think about how you're going to move forward creating positive strengths-based narratives, but also how you address the ones that exist now that may have been written from more like a case file or a challenge perspective. So again, you want to have another thing you might need to implement is a review for quality assurance. So that you have, there's one or two people who review all the narratives, especially early on if you're making a change, like, oh, hey, there's something that we don't think should be in there. Let's make this change. So that's another thing administrators can do. The other thing we talked a little bit earlier about is having a scheduled review for narratives and photos. And so maybe you have a policy that they have to be reviewed every 6 months, updated at least once a year. We know all children are being visited by their workers, so there are opportunities to, maybe before you go out on those visits, the worker takes a look at the narrative, like, oh, let me see if anything has changed. So just making it a part of that casework, same with recruiters, obviously. The other thing that administrators can do related to photos is work on partnerships with professional photographers. We know there are some wonderful photographers out there who are willing to volunteer their time to do photos, and but usually takes administrators either funding a program or supporting a program to make that possible. So those are some of the things that administrators can do to make a difference. I'll move on to what workers can do. And again, by workers, I mean there's really two different, Tracy, it's actually the next slide. For workers, I'm going to talk about workers and recruiters, and I'm going to sort of do some lumping together of first I'll start with people who are actually writing the narratives, and then talk a little bit about workers who aren't writing but are part of the process. I think the first thing you can do, again, even if your system doesn't have a policy on it, you can say, but I am going to take this on. I am going to make sure that I have strengths-based information and I'm going to get the details. You can take some of the questions we have in these slides and we have on the AdoptUSKids website and make sure you're asking those questions. You're observing the children so you know what they like, what makes them laugh, what food they reach for. You can just do that. You can develop your own guidance. You can actually go to your administrators and say, hey, I'd really love us to adopt guidance like this. Can we have a conversation about it? You can be the change leader in your community to make it happen. You can use a checklist of what to include, what not to include. We have one on the AdoptUSKids website from this guidance that we're recommending. You can make your own, and you use that, and you review the narratives with that in mind, especially in the beginning. And I'm a little sad that I put this bullet third, engaging youth. It probably should be number one. Engaging youth, whether it's asking them the questions, what do you want to say, what do you want people to know about you, having them review it, how does it look to them. And again, all of this done with children who are developmentally able, but whenever possible, engaging youth in how they want to be described to the world. I'll say only one caveat there is that I would still say if a youth wants to include something and it still doesn't meet the guidance, I wouldn't include it. We've seen young people say things like, I would like to be a better person, or I wish I behaved better. I still wouldn't include that. I'd include other quotes that they say, but I wouldn't include things that show maybe some challenges they have to overcome. So I wouldn't use their quotes to override the guidance, but just, again, having enough information you can choose from. Another one, obviously, is engaging foster parents, and I've a little slide if anybody is a foster parent, but I think they know these children day in and day out. You can ask them to review the narrative, is this still accurate? Or you can say, hey, I want to have really positive information. What are the best things you have to say about Billy? Just getting the people who know them best and getting them on board. And they can be the ones, you can have your foster parents review them and say, oops, hey, I'm not sure that should be in here. That's not true anymore. And then I'll talk a little bit about the actual writing of the narratives. I think one of the best things to do is identify and share narratives you really like and try to emulate those. I think any of us who do writing learn from others. And if you buzz through your photo listing through AdoptUSKids, we have some sample narratives in the guidance that we have online. And think about those when you're doing your guidance. That really there's great creativity that can happen. Let's do a few little things about writing. One of the things is if you have all of your narratives structured exactly the same, I think it can end up being you can lose readers, because so many parents might be looking at 10 different narratives in a row. And if all of them are exactly sort of a template where you just filled in adjectives about their favorite foods and their favorite class and what they do in their free time, it really, as a reader, and again, trust me, this is somebody who has read a whole bunch of narratives, you start to tune out. And the fifth child feels like the second child, and the fourth, and nothing stands out. But if you mix that narrative up, so you start some with, this budding scientist would love to have his own lab someday. He excels in biology and chemistry. So you're starting with what he wants to be. And you might start others with more traditional. Bill is a true music fan. He spends hours listening to classic country as it helps his foster parent work on the car. That you can, so it's not name, adjective, thing they like to do. It is you might start with where they are in the future, some with what they're like, some you might start with a favorite food. I'll say a couple other things about food, I think, and not just food, but other tips for writing these is if it's something that every child loves, try to get more details or try to get something different. The number of narratives that say, he likes to play video games, it doesn't help that child stand out. So if you ask the questions, as we talked about earlier, if you ask lots of questions, you're going to get different details that make a child stand out. And what's different about them than the other children? What is the thing that makes them stand out from the crowd? Again, the details can help with that, but also, if you read one more profile of a child whose favorite food is macaroni and cheese, you maybe leave the favorite food out if it's not interesting or different. If you need it for filler, it's okay. There's nothing wrong with it, but trying to give life to narratives is really important. I'll say just a couple of things about specific language. I'd say watch for code language and hints even in your own work, even if you're doing this. See things like a kid is very energetic or she does this fairly well. Both of those do better without that adverb in there. So he is energetic and she does this well is a more strengths-based perspective. The other thing I would say to watch out for is the word but. He has friends but only a couple. Is if you're seeing the word but, usually means there's something that's not as positive. You could just say that he has 2 friends that he loves to spend time with. So those are things, just little tips to think about as you're writing the narratives. And then I'll just say separately that so for people who are writing them but are not the worker and you're partnering with a worker, one of the things is, again, to help the worker understand the new philosophy and make sure you're explaining why something matters or why you want the detail. I think, because sometimes we just are used to doing what we're doing, and you need to be reminded that, hey, we want some details here because that might be what triggers somebody's interest in coming forward. Again, I think workers, even if they're not working on narratives, can help communicate to foster parents that, hey, we'd love to have you talk to the recruiter. You can help make that connection. And you can contribute to the private narrative, of course. If you're the worker, you want to say, hey, these are things I want to make sure is in a private narrative or that are shared with home-studied families. So those are some of the things for what workers and recruiters who are writing narratives can do. And then I'll say just a couple things about prospective adoptive parents. And again, we're talking to you all as professionals in the field for the most part. So really what we want to do is help prospective adoptive parents think about this. And some of this I've already covered. Part of it is to, prospective adoptive parents need to think of themselves as protecting children. This is their first step in becoming an effective adoptive parent, is to put the children's needs first and do all they can to protect the child. And they may need to accept that it could take a bit more of their time because they might have to look at a public narrative and then a private narrative. If they're not home studied, they may need to go learn more before they get details about specific children. And so again, what this is where we'd say that what the role, as you're sharing information about waiting children, this is some of how you can frame that information before a photo listing. And just explain, in the public narrative, we share information about a child, what a child likes and their strengths. And for home-studied families, we share more information if you register, or if you have a home study, we can share more information with you. So it's part of what professionals can do, is help prospective adoptive parents understand that this is the best thing for kids. And I think one of the jurisdictions we talked to when doing this work was Kentucky, and they don't share any information about kids until they're home studied and have signed a confidentiality agreement, which I also think is a really great way to get. And they said that they had parents saying, oh yeah, we're in this together. And they really felt that the prospective adoptive parents became part of the team and part of the protecting their children through doing that. It really can kind of help them understand children's needs early on. The last thing I'll talk about, I think, is what foster parents can do. And I've said a little bit about this, but this is information that, for you as professionals, can share with foster parents. They can review profiles. They can make sure they're accurate. They can do the questions with the young people where they might be most comfortable answering those questions. They can jot down notes on, oh, this is what he laughed at today. This is what he was so proud when he came home from school with his reading certificate for reading 100 books. You can have them jot down notes that they share with their worker or the recruiter. Foster parents can be the ones helping remind workers and recruiters that, hey, it's time to update the narrative. This big thing has changed, or something is different now. They can certainly let workers know if a young person saw the narrative, if anything has happened, if they were bullied at school. We talked to people we had a student a young person who was photolisted who called from their school to say, hey, I've seen this in my narrative and I want it changed. And that just showed the power of if a child is in a school looking at their own narrative. And I think, foster parents can support young people who are bothered by a narrative and help them make changes in that. And the other thing that foster parents can help with is photos. Most people have a smartphone these days or a digital camera, and they may be able to get photos at a time when the young person is more relaxed and is not stressed out during a visit. They may be able to get something, they may be able to try a bunch more times for some of the kids who are more difficult to photograph. They'll have more opportunities. Again, you want to make sure you're removing any geotags if it's taken from a smartphone, but those are some of the things that foster parents can do, and that workers can help them understand their role in that process as well. So Tracy, we are ready for more questions if folks have any.
Okay. I'm going to summarize some of them. So we had a question about removing geotags from a photo that is submitted, how to do it. And Anna put instructions which I copied and pasted into the chat window. So there are instructions there about how to do it and how to get more information. We also had a question about could that information that she shared is in the chat be shared with the group after. Mary, do you think that would be something that we could do as a follow-up?
I would think so, and if you say it, then it'll be on the recording.
Okay.
Or is it detailed?
It's detailed.
Okay. Okay, we'll send it out. We can add it. We can add a slide, and when we send out the slides, we can add it there.
Perfect. We had a question about we had a couple questions sort of clarifying on the AdoptUSKids site what is visible to who can see what at what point. And Juana, I know you put some information in the chat window, but could you speak to that as well? And part of that was about who can see a checklist of special needs and who can see the private and public.
So the general public, we show them the child's first name, the age that we generate based off of the birth date that's entered, the state the child is in, the photo or silhouette, and the public narrative. The registered family will see that summary information, the public narrative, the private narrative, on the disability tab, if permission was given to share that information with the registered families, and there's 2 levels of sharing. You can share either just the mild, moderate, the non-mild, moderate, and severe, or you can share the overall levels plus the specific details. But the default is to share none. But whatever is selected there, then the registered family will see that. If it's none, they just get a general message about HIPAA and privacy. And when a family makes an inquiry, they then see the contact information, the registered family.
And Juana, if that's the default, then is that checklist included in the confidential section for registered workers?
So registered workers will see everything. So they'll see all the disabilities for the child and all 3 narratives. So.
Thank you. I think that gets to it. Mary, a comment we had that I thought you might want to speak to, less of a question, but it's about out-of-date narratives, but in quote, he loves playing with Hot Wheels and coloring for a 17-year-old may lead parents to think a child is severely delayed. So I think the person is kind of getting at, is including that information in the public okay? What are your thoughts on that?
Sure, and I would say this is what, again, I could have said much more about updating, and that is one of the things, like you could have the same thing with school. He's in the 3rd grade and you have a 16-year-old because the age is being updated automatically in many systems, and but yet the details haven't, which that would suggest a significant educational delay, which we would not put in the public narrative. So that's why one of the most important things is to update the narratives. But if you have a 17-year-old who loves playing with Hot Wheels, I think it's okay to put in there. I mean, that's, again, it's about who they are. And as we talked about with kids who are nonverbal, there may be things they're saying. If we're saying that, oh, she loves to point and she loves light up toys, that may suggest something, but that's also who they are and what they like to do. And so I don't think you need to censor it, but if you have other information, you could also use other information instead. And I think that's part of why I'll keep beating the same drum of saying the more information you get, the better choices you can make on what's the most compelling and most interesting to families. So you want to start out with more information than you need, and then don't include everything if you don't need to.
Thank you. I'm going to try to summarize another one. We get a lot of inquiries, the majority of them, from families who are not registered with AdoptUSKids, but do have a home study and are approved to adopt. And those families do not have access to the information that registered families have in the private narrative. We receive, this sometimes feels like we're tricking the families, and they end up feeling discouraged. This person's agency only permits families to make a certain number of inquiries. And so that can especially cause them to get discouraged because it seems they feel they don't have enough information to know which children to inquire about that might be a good fit for them.
So I'll say a couple of things there. I hope I got it all. But the first is, well, have them register on AdoptUSKids. Now that can take a little time because they do have to be verified by their worker. But they should register on AdoptUSKids if they want to learn more. And again, this is part of helping them be their own best advocate. If they are, again, if you're talking about your own system, you may want to think about different ways you can share that information. The other thing, I'll bring up Kentucky again. What they have as their first step in the process, because as I said, they don't share information early on, but if they have a home-studied family, they have them fill out a form saying what type of child can you parent, or what are what are you interested in? So it's like what you do on the online photo listings, but they have them do that and send it back in. And if it's not a good fit, they say, this child isn't a good fit for you. So yeah, it is a few more steps, and I think this is part of why we talk about this as a paradigm shift, and that parents have to be on board too. That again, and everything has to be done to them in such a positive way. Thank you so much for your interest. We really want to help you, but this is the way we have found it best to protect children, which we know you want to do too. So, but I think the shortest answer is, can you find out a way to get them to register on AdoptUSKids and let them know they will get access to much more information there for the children registered on AdoptUSKids.
Thank you. Juana, if AdoptUSKids removes geotags from a photo that is submitted, do you let the person who submitted it know so they also remove the geotag?
No, sorry. We get so many photos to process. We don't actually look at everyone to see if they have tags. We just know that our process strips it out. So we don't worry about the geotags getting up on the site.
Okay, great.
So I would say
yeah, go ahead.
Oh, I was just going to say, so what the person want to do is think about where else they're using the photo. So if they have a state photo listing or a regional photo listing, check that system may well remove those as well, but they just want to be checking there.
Is it preferred to have children's last names on AdoptUSKids or first names only okay?
First names only.
When you register a child, we provide both, but it's up to you whether you want to include the last name. It's really for your purposes if you have multiple children registered with the same first name, if it helps you identify, like when you're looking at a list result of just names to know who is who. We never show the last name to the public, to registered families we don't show it to. we don't show it to registered workers unless that worker is in the same agency that the child is registered in. So basically your coworkers will see the last name, but other workers in other agencies won't see it.
Thanks, Juan. And let me just say, yeah, and I was definitely talking about the public narrative only, that obviously last names would be identifying information. And we do, I just want to say about, we've seen some places where you use a last initial, and if it's a very unusual first name in a smaller community, that actually could lead somebody to find someone. So just even think about that in terms of what is displayed publicly.
I guess one last question. If AdoptUSKids manages our state page, do you remove geotags there too?
Yes, it's removed from those as well.
All right. Is that it?
I think so.
Okay. Well, I thank everybody so much, particularly thank Tracy and Juana for helping out, and for Anna for answering some of those technical questions behind the scenes. I really appreciate everyone's being here today, and hope you'll take the time to fill out the evaluation and let us know what you thought, if this was helpful or not, or what we could do better. So thank you all very much.
Thank you, Mary.
Bye.
Thank you.